Hello, my name is Ayana Ali, and I'll be discussing major depressive disorder. Major depressive disorder is a condition where a patient suffers exaggerated and severe episodes of depression lasting more than 2 years. This disorder manifests as persistent feelings of sadness and hopelessness, loss of interest in activities formerly loved, and low self-esteem, despair, pessimistic thoughts, and thoughts of suicide. This is diagnosed using the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM-5. Risk factors for this disorder include lack of social support, history of trauma or abuse, substance abuse, major events in the life, such as losing a loved one, unemployment, financial difficulties, or divorce. Family history of mood disorders, imbalances in neurotransmitter functions, hormonal imbalances, and adverse reactions to medications such as corticosteroids or beta blockers. The cause of major depressive disorder is a decrease in serotonin, dopamine, and norepinephrine levels. Another cause of major depressive disorder is neurotransmission malfunction. This is where a decrease in GABA synthesis and a decrease in the tone of mood-regulating neurons occur. Treatments of major depressive disorder include psychotherapies. This is where the therapist would focus on the patient's maladaptive and possibly destructive behaviors. This is the first-line treatment for major depressive disorder and includes cognitive behavioral therapy, interpersonal or family therapy, psychodynamic therapies, and possibly occupational therapy. Other treatments include pharmacological interventions such as select serotonin reuptake inhibitors, also known as SSRIs, serotonin norepinephrine reuptake inhibitors, also known as SNRIs, antidepressants, tricyclic antidepressants, also known as TCAs, or monoamine oxidase inhibitors, also known as MAOIs. The last resort treatment for major depressive disorder is electroconvulsive therapy. This is when a patient has a seizure induced, causing hyperactivity in neurotransmitters. And in order to be eligible for this treatment, a patient would require failure of all pharmacological interventions, experience severe depression, and suicidal ideation. This treatment does cause short-term memory loss and confusion. Important patient teaching would be to teach the patient about coping mechanisms and encourage the patient to reach out to friends, family, and support groups and provide them crisis resources. As far as medications, it would take 2 to 4 weeks for medications to become effective and to not stop them abruptly. And once they do become effective, to monitor and report any suicidal ideation that comes about during that time. Also teach the patient to increase fluids to manage anticholinergic effects brought on by the medications and to avoid alcohol consumption. Interventions that the nurse would likely take would be to assess and monitor the patient for suicidal ideation, in patients that are at risk for suicide, to maintain a close one-to-one supervision with them. The nurse would also remain non-judgmental and establish a trusting and therapeutic relationship with the patient, remain consistent with daily routines, and assess their dietary habits and potential need for a dietary consultation, and encourage the patients to be physically active and exercise regularly. Thank you.